Hi, my name is Tom Lapau, and I'm here to talk a little bit about working with children in our line of work. I think the reason why they asked me is because in my practice, I used to specialize in working with especially male children between the ages of 10 and 18. Now, one of the things that we need to take into account when we're talking about children is that there's a difference in motivations and goals. One of the crucial elements is first the fundamental motivations and goals that we always have for our clients. And this is their social development, their emotional regulation, their interpersonal relationships. This is something that we can work on all aspects from. The beauty of working with children is that we can make a difference very early in their lives, meaning that this will benefit them along the duration of their lives and potentially prevent issues down the line. With children, you always have that disconnect between parents' goals and children's goals. Now, it is lovely if the parents have the same goals as the kids. Very often, the parents' goals are kind of opposite to the child's. How many times we hear my child needs to come to therapy because they're not dealing with their emotions because they always get upset, and the child saying, I don't see any problem. So that is something to tackle and probably be very respectful to all parties as well, that you will respect their goals. Second part that is very important when working with children is the relationship. Now, if you work with adults, there's a certain implicit relationship already there. Why? Because an adult knows what your position is, they know the definition of your role, but also they expect a certain expertise, and they also expect that they come to you with an issue and that the issue will be resolved. So they're there, and often they are solution focused. Whereas with a child will sit back first and first think, can I trust this person? Do I feel safe with this person? Can I confide in this person? So with a child, it's much more important to build that relationship of trust, safety, and confidentiality first before we even start doing anything that is our therapy. Now, the third part comes back to that confidentiality, and that is ethics. Children need to be able to give some form of informed consent because you want to involve them in that whole process, but some children can't because of developmental issues, but sometimes also age-related. The second part is confidentiality. What is the child able to say to you that won't leave that room? And you really have to watch out with that and really look at the legislation for your profession and in your setting. Certain things have to be mentioned because by law, you have to notify authorities, for example. Other things, there's often a bit of a small balance that we're working with. How much do we tell parents? How much do we tell? Yeah. I often ask parents that some of the information can be kept between myself and the child, and so please respect that because it will only enhance the relationship. The second part the fourth part, the treatment part, focuses on differences. Now, as I said before, I used to work with especially male adolescents, male teens. That is because I am a male practitioner. And being a psychologist, we often delve with sometimes very risky and sticky topics. And sometimes I wanted to avoid that being one-on-one with a female patient. Now, this is a personal choice that you make. Nobody is telling you to make that choice, but this is something that you need to think about when you're working with kids. A lot of the things and a lot of the differences are dependent on developmental age. Make a note, I didn't say chronological age, I said developmental age. A lot on the gender as well. I just said I avoided working with female adolescents. That doesn't mean I never saw any, but I was very picky in which kind of female adolescents I wanted to work with, which kind of topics I worked with, and sometimes also other characteristics. Now, another very important part, especially if the children are very, very young, is that you join with the parents. What we often see is that teenagers and younger, they often want to see that you've got a good relationship with the parents, and if the parents trust you, they will trust you. Now, with adolescents, it's almost the opposite. If you are too joined with the parents, they won't give you too much material because they think that you might tell the parents everything, or that you will only take on the parents' calls, and that the confidentiality in the relationship is gone. Now, I hope that this small video just gave you a little bit of introduction. And I think what you need to remember most is look at the motivation and the goals, and look at which ones you're getting from which party. Think of the relationship that you're building, and that trust, that safety, and that confidentiality. Think of the ethics, confidentiality, but also the informed consent. And then the fourth, think of treatment. Are you comfortable treating these children with whatever it is that they come into? Well, I hope that really helps, and I wish you all good luck with soon.